Welcome to The Divine Style with Gerlinda, Stella, personal stylist and spiritual mentor, and Alison, Maiden, psychic medium and metaphysical teacher. Each episode we share spiritual lessons to cultivate self-love and self-expression so you can become the best version of you. I'm Gerlinda.
And I'm Alison.
Today we are talking about beauty isn't just skin deep. And I think as spiritual women and goddesses and any men out there that listen to us as well, often people in the spiritual community think that beauty is literally like a bit too fluffy, or, you know, we should be thinking about more meaningful things. But as a personal stylist, I definitely believe that beauty is more than just the way we look, but also it's a reflection of how we do feel about ourselves on the inside. And there is nothing wrong with feeling and looking amazing on the outside to reflect how you feel on the inside.
I totally agree. And as you get older and you feel like you're looking in the mirror and thinking, hey, that's not me. Or how I feel inside, and what you're looking at isn't yourself. And I know a lot of women feel that way. And we have an amazing special guest today, Amanda Fritz. Thank you so much for joining us.
My pleasure. It's lovely to be here.
And Amanda is actually very, very good in her job and how she works with the aesthetics industry, and she has a great deal of medical knowledge. And I'm going to let you introduce yourself as your background, etc. But I know you've helped me immensely with a few problems that I've had. And I just wanted to get it out there to everybody that just because people are going for Botox and fillers and those sorts of things, it's not always something that people should go, oh, that's just superficial, because it's not.
Absolutely not.
No.
So I've been a registered nurse now for 16 years. I'm also a medical sonographer. So I'm able to use both of those skill sets, in my practice as a cosmetic nurse. I started off being an ICU nurse, and then I went down the path of working in orthopedics and working in the home and community. But I also worked for a plastic surgeon in Brisbane, and I guess I've always had a really good aesthetic eye, and I've always had a passion for women's health and women feeling good about themselves. So when we worked in Brisbane, we worked with a lot of breast patients, so not just aesthetic purposes for breast work, but also reconstructive work, ladies post breast cancer.
Oh, yes.
So I've always had that passion to really help men and women, but I do understand and realise that there is a stigma attached to coming and getting Botox or coming and getting fillers, and it's just not for the aesthetic purposes as well. It's also to make people feel good about themselves, and people are born sometimes with asymmetries that they've had their entire life and not realise that, you know, in an hour's work we can fix that for them. And
Can you explain a bit more what an asymmetry means?
So an asymmetry, I guess, is, you know, part of the face that everybody is asymmetric. There's not one person on this planet that is symmetric both sides of their face. So, we've demonstrated that with models. Models have put their faces, and we've put one side of their face and completely replicated it to the same, and they just look alien-like. So everybody has an asymmetry, but to what degree that asymmetry is very personal and independent. And looking at people, there are people that have very marked asymmetries, and they are aware of that. So they come in and they know that there's something not quite right, or they do know what's happening, but they just can't put their finger on it, and they've suffered, they've been bullied, they've, really hid themselves from society. And I love to, they walk in and I kind of straight away know what they're going to say, but I really do take the time to sit and talk to them about their background first. The talk about the treatment plans, that comes secondary. You've got to understand where people are coming from, and that really helps to not only develop a rapport, but you can empathize with what's happening. They trust me then, and I have a understanding of who they are as a person and what aesthetic goals they're looking for. You can you can gauge that through a conversation. Yeah.
Yes, and I think what I loved about Amanda when I spoke to her, because I'm just going to go in briefly into what you did for me. So as you guys know, I have a lot of food allergies, and I often get those terrible migraines on this side of my face. And it does come down to a lot of muscle issues on this side of my face. And I was recommended that Botox could help with that. And it wasn't purely for the wrinkles, although that was a good side benefit. Extra bonus. It was to actually relax those muscles around my eye that were causing the issue. And when I first heard about it, I was like, no. I was scared, because when you hear these stories about some of the things that go wrong, and there's some horror stories on Google.
Absolutely.
Of course I Google.
Don't Google.
Face dropping.
Yes.
Oh, gosh.
Yeah.
And I wanted to go to someone with a medical background and who was definitely a practicing registered nurse who actually, and I know that you consult with a doctor because I've spoken to the doctor beforehand. So, and what you did, where I've had treatments before that haven't worked, is you picked a muscle that was causing the issue. And I swear to God, as soon as the injection, like 2 weeks later, it was gone. The pain was gone.
Amazing.
And that, to me, you would not believe how that has made me feel.
Yep.
Because I was constantly having a headache all the time. And in my work, that's really difficult because I've got to sort of put the pain aside and get on with what I'm doing. But I have been pain-free now for a good week and a half, and it's been incredible. And I've got to say thank you so much.
Oh, my pleasure. I'm glad.
But I know that Gerlinda and I talk about this all the time, how as women get older, I mean, you as a stylist, you know, when you take someone out, it doesn't matter what size you are, and as you get older, you know, you're going to get bigger, or sometimes even smaller. Sometimes people go the opposite way. Clothes just hang on you, or they don't fit anymore, and we feel like our bodies are the issue. But a lot of the time is because we're looking in the mirror and we're not feeling like ourselves anymore. And again, I've got to admit this, because of the side benefit of having this injection, and I saw that the wrinkles were going, oh my God, I actually feel better. I actually feel better when I look in the mirror.
Yeah.
And of course I had to have the other side done, because I couldn't have just had
No.
one side.
Yeah.
Then you'd be really asymmetric.
Then I really would be. So, I mean, for me, personally speaking, it has been such a benefit. And I haven't had the full thing. I still look my age, and that's fine by me. But I just feel that it's such a benefit for people to even have a consultation with someone like yourself, to talk about these things, get over the fear of it.
Absolutely.
Because why should we live like that?
Yeah.
Why can't we just, as long as it's healthy and it's fine for us to do and it's safe, why should we, put ourselves through that?
Absolutely. And I offer free consultations for that exact reason. 90% of the people that come in that are first timers are nervous. Like they do Google, and they do, what's out there are the horror stories, and there are risks involved with injections. That's, there's risks involved with everything, but we go through, from A to Z. We talk about everything, so that my clients are well informed about what is going to happen. They're aware of the risks. They go home with aftercare. We talk about aftercare at the consultation, so they feel empowered when they come, and have the treatment's kind of like, did we do the treatment? Is it done? It's all the talking. It's all the getting those fears out, getting those anxieties out, so that they're comfortable. And once I've got a comfortable client, the rest is just, it's so easy. They're just relaxed, they're calm, they're aware of what's happening, they feel in control of their treatment. And that's really important to me as well, that someone's not just coming at them with a needle.
It's not just a production line.
Absolutely not. There's so much more. There's so much more to it. You want to feel like you're in control of what's happening. It's, at the end of the day, we're putting a medication into your body, so you should know what that is. And feel comfortable enough that that this treatment's going to happen, and know exactly what your risks are, know exactly what your aftercare is, speak to a doctor, and then we always do a review appointment anyway. My clients have 24 access to me, so should they feel concerned about anything, they've got me right there. And I think just having that that comfort is a comfort to them, especially as a first time client. It is scary, But you know, most of the time they get to their 2-week or 4-week review, and what's next?
Yeah.
So what sort of cosmetic sort of procedures, for lack of a better term, what sort of things do you offer?
So we do both aesthetic and medical procedures. So a lot of people suffer from bruxism, you know, teeth clenching or teeth grinding.
Yes.
So and that causes a lot of people suffer.
Just psychic when you tune into someone that does it and your own jaw goes all tight. I felt it.
So
it's not great.
and that causes migraines for people, and that's something that people don't recognize. So when someone comes in and I can see they're quite bulky, they don't even know, like, well, I'll talk about it and I say, oh, do you wake up with a bit of jaw pain, or do you suffer migraines? Oh yeah, I've suffered migraines my whole life. And you know, they've got big bulky masseter muscles. We can treat that and their lives are just completely changed.
Wow.
So you know, that's a medical procedure.
Yes.
Hyperhidrosis, sweaty armpits, you know, we live in Cairns, we live in the tropics, and people are very self-conscious, men and women are very self-conscious, but there's a treatment for that. Sweaty palms, you know, people holding guns as like a police officer, and you know, being conscious of it slipping out. There's, you know, things like that.
Wow, that's like a safety issue.
Yeah.
I wonder if they could claim that.
Yeah, probably. But yeah, there's, you know, there's that side of it as well.
And look, and I actually do suffer from hyperhidrosis, and I do get Botox under my arms, and it's life-changing because
there you go.
it stings a little bit, but I've been doing it for a couple of years now, and a doctor actually recommended it to me, and it changed the clothes that I could wear, and I've recommended it to lots of clients of mine, and like you say, being up here, it's one of those things.
Do fellas tend to pick that one up a lot?
They do. They are very self-conscious about it. Yeah. And I treat a lot of male patients who come in for that exact reason. And, you know, I get male, like Botox, we call it. You know? It's becoming a lot. It's becoming a lot more popular and acceptable by males. I just had a male client have lip filler, and he was more than happy to share it with all of my followers that it's okay for males to engage in aesthetic treatments.
Was it because he had an asymmetry?
He did,
issue?
yep. So
Right.
he had a smaller top lip than a bottom lip, and when we talk about the golden ratio of a lip, or the golden rules that, you know, we use as practitioners, he was definitely smaller in the top lip, and he said, I've suffered from it. He had beautiful teeth, had spent all this money on beautiful veneers, and he was really self-conscious to the point where he was growing a beard. And so
this is the thing.
Exactly. Yeah. So, you know, he contacted me and he had it done, and I said, you know, you don't have to share it, but it'd be amazing. And he's, go for it. You know, he's a tradie, he's a man, he's a boy's boy.
That's so good.
Yeah, and he just, no, go for it. You know, this is,
I
like
need that.
He's amazing. And I got so much feedback, positive feedback, from that, from men and women, you know, saying good on him. And it's, like I said, it's, you know, men suffer insecurities just like women do.
Yes.
And I think they need to know that it's okay for them, and women too. It's okay to want to feel good about yourself. You go and get your hair done. You go and spend money on your nails or your eyelashes. This is your face. Like, this is something that we show to the world every single day. And I can't tell you how amazing it is as a practitioner when clients, you know, get the mirror for the first time and we've done a little bit of a glow up, the tears, you know, we both, it's just amazing. You know, people just will message me or call me and say, you've changed my life. You've absolutely changed my life. I feel like I can go out now. Or they'll come in and they've got a funky new suit on and their hair's done. I was like, oh, you know, what have you been up to? And they just said, I just feel amazing. So I get dressed, I put my makeup on.
It makes a big difference.
And I feel good about myself. And that's, you know, we need to get rid of that stigma of what you know, is not positive out there about what, you know, fillers, anti-wrinkle, aesthetics is all about. It's actually more about making people feel good about themselves. So that's
I guess playing devil's advocate, so I have a 21-year-old, she's almost 22, and I do see that a lot of young girls are going out younger and younger and feeling like they need these medical procedures when somebody that is almost 40 going, that I'm getting the fillers or getting all these, the Botox or whatever to try and have that more youthful appearance, but I'm still really happy with the aging process. Like, I'm okay, especially at this age, I feel okay with where I am in my skin. But what do you say to young girls that, they've noticed like a tiny little crease or a little wrinkle? Like, what about an age? Like, do you believe there's an age that sort of is recommended in that way?
Yeah, I think when we think about anti-wrinkle, it is a prevention. We are stopping muscles from causing lines in the skin. So it's not just for after we've got those lines and we're stopping them. It's for a preventative purpose. But I guess when we talk about young girls, they are so impacted by what's happening in social media and the filters that they have now, and
the filter isn't your face. Like, it's actually quite scary.
I know, it is quite scary. And I have seen a couple of young girls, not so much for anti-wrinkle, I would say more fillers, and I think the first place that girls like to start are lip fillers.
Okay.
But
which can go too far.
Yeah, 100%. But I've got a nearly 18-year-old daughter myself, so I'm quite protective of the young girls that do come in, and we do have the conversation around what's brought them in, and the girls that I have treated, they truly have, they've suffered from small lips their whole life, or they've been teased, or they actually do have some sort of asymmetry, or it would be fine on them. And I'll always there's different types of fillers and different types of treatment, and I'm very conservative as a practitioner, and that goes for an 18-year-old or an 80-year-old, because I have treated 80-year-olds.
Oh, wow.
God bless them.
That's awesome.
And we always start off as a journey, and I always educate my clients and say, look, Rome wasn't built in a day, and we'll always start nice and small, and this is the same as my young girls, and see how you feel, see how it sits on you. This will change your face, and you may go home and look in the mirror and you will feel different. So your brain needs to adjust to that, and you may want to come back a little bit later and just a little bit more. And we do things very slowly in my clinic, and my clients are very happy with that, because it is about tweaks, keeping things natural. I'm very, I want to stay natural. I'm holistic in my approach with my ladies and my men. We just keep things quite simple, and we just go, slowly through the process and make those changes slowly, because, the first thing people normally come in and say, I don't want my husband to know.
Wow.
I don't want my friends to know. I don't want anyone to know. Don't give me those baboon lips. That's normally what I get first.
We're not talking about the front of the baboon.
No, that's the normal. Okay, yeah, we've got past that question. Let's go. So yeah, I'm very, very. I always explain to them. They may need. When we talk about fillers, 5 mils. I think it's one. Well, not I think. It's 1 mil for every decade over 30, basically.
Wow.
So that's how you look at it. So 5 mils is a teaspoon. So you think of how small a teaspoon is, and that's 5 mils of filler. What you can do with 5 mils of filler is quite amazing.
Okay.
So someone might come in and they've waited till, quite late, they're quite volume depleted, they've spent time in the sun, or they're lost weight, or they've been sick. They might need 5 mils, but we start with, small treatments, and we just tick along.
Her friend's not going to go, what have you
done?
done?
More like, have you had a good sleep?
Yeah, she looked fresher.
Yeah, what have you done to your hair? And that's, that's the way that I like to practice. We might do 2 mils, and there might be 2 different areas, but it's just soft enough for them to see a difference, for them to feel good about themselves, and then in 4 weeks' time, or whenever they're ready, we do a little bit more. And it's just about chipping away and keeping it natural, but so that they're still feeling good, and that everybody's noticing a change. But what's the change? Then they can't say, oh my gosh, you've had what have you done? You know,
See,
it's not about that. It's
a lot
about
of people are very self-conscious about sharing anything
oh,
to do with
absolutely.
their bodies,
yeah,
etc.
absolutely.
I tell everyone what to do.
Yeah.
Just like, oh,
Well, I think
what's
after
going
you
on?
said you got Botox, I'm like, I'm going to get Botox.
Yeah.
But especially for the headaches, because you did tell me,
Oh my
and
gosh,
it
it was
changed
amazing.
mine because I
Yeah.
get headaches. So
I was so shocked, but I've got to say that it was after your treatment that it was really, really helpful for me.
Yeah.
I'm really interested to talk a little bit more about the fillers, because I hear stories about fillers, and there's good ones and bad ones on the market, obviously. But they're basically made of something that's quite natural, naturally occurring in our body anyway. Is that correct?
Yeah, they're predominantly a hyaluronic acid. So everybody has hyaluronic acid in their bodies, and there's different thicknesses of fillers, I guess. So you know, you've got there's all different ranges of fillers. They're made in different, you know, countries, different brands and all the rest of it. But I guess the biggest thing is you could put a filler in my hand or a filler in another injector's hand and another injector's hand. It's how you use it.
Yes.
You know, that's the biggest take-home message.
Yeah.
We could all use the same filler, but it's how it's used, it's how it's injected, what techniques used, what...
Oh,
little friend.
Little spirit
Sentient being.
You know, and clients will come in to me and say, oh, I hate these. Like, I hate these nasolabial folds. But I see something complete, like they've got mid-face volume loss. So, you know, I would never go...
They're just pointing out the one thing.
That they see, but we need to,
Yeah.
like, you need to peel it all back. It's like you've got to peel it right back and say, well, that's what you see, and that, you know, completely understand what you're seeing. However, you know, that's my area of expertise. You've actually got, you know, a bit of mid-face volume loss. If we, you know, help with that, you're going to feel so much better about these. You know, we may need to come back in and treat that, but, you know, you've got to, it's like I always use the analogy of building a house. You've got to set a foundation first, then put put your roof on. So
you do see some
I know.
horror
So
stories.
you,
I mean, you do. Don't
you would never go in and, you know, if someone's got, you know, it's like a puzzle. You've got to put the pieces in place to get that natural look, and you do see.
And I think you're quite right with people judging themselves from, like, Hollywood stars, for instance. That I actually went and saw. I don't know if you've heard of Judith Lucy. She's a comedian, an Australian comedian. I went and saw her once. And she was talking about Nicole Kidman's forehead, and it was the funniest thing of it. She said, you could actually put a fridge magnet on that.
Oh, gosh.
And that, for me, was it just sort of brought it home that when you look at her in her younger years, how her forehead was a normal size, and now it's really looks like it's elongated.
I know.
Is that a hairline thing, do you think? Or
I don't...
Too much Botox,
You see
perhaps?
so many... you know, you'll see memes on Instagram or Facebook, and they use, or even from an education point of view, when we go to conferences, they will use celebrities on not what to do. And I don't know who's injecting them, but you know, like, this is not what the look you want to go for. You know, dropping brows or how we treat men is very different to how we treat females, and you know, it's
It was amazing. The first time I did get Botox in my forehead, I remember walking away and my eyebrows felt heavy and it was really bizarre. And so the next time I went back, the nurse actually spoke to me instead of the dermatologist who I saw. And the nurse was the one that said to me, you don't need that much. You can have half that. And it was phenomenal to have somebody listen.
Yeah.
I think that's
and I
the
guess,
key, isn't it?
I guess that's when we, you know, it's about treating what you see, not what, you know, not the financial gain from it. I guess you want to, that person only needs this amount of Botox, and that's what it is. That's going to get them the aesthetic outcome that they're looking for. And you might want a frozen forehead, and you might want some movement. So, you know, it's about gauging.
That's right. I know, because it was like, I was like, I can't move my eyebrows. Like, it was a bit bizarre.
No one likes a deer caught in headlights. No, and that's very much, you know, people will come in with those horror stories, or I couldn't move for 6 months. Please don't do that to me.
Gosh.
And you've really got to understand what people are looking for.
Yes.
You know, it comes down to that. You're going to have good aesthetic outcomes if you take the time I'm an empath. I will always sit down. I love to, I've said it so many times, I do honestly have the best clients in the world. All my clients are, they're like my friends and family. We always have a chat first, and my new clients are exactly the same. You've got to spend time. You're about to put a medication in someone's face. It is, we're either relaxing muscles or we're we're not there to, we're there to enhance someone's natural beauty. We're not there to make them look weird when they walk out of, or people are spending money on this. This is their hard-earned cash as well. It's not like they're going to come in with their $2. It's people save for these things. It's a real honor to treat people and make them feel better about themselves. So you need to give them that time and find out exactly what it is they're wanting. And it might be something small, it might be something big, but what you want and what you want are two very different things. And how your pattern is, and your...
She's 20 years younger than me.
Yeah.
The thing is that, and I wanted to talk to you too about the mishaps. So if somebody did, and not saying that you would do this, because I know you're very good at your job, but what if somebody did have a mishap where a little bit too much of filler was put in or something like that, or they really hated the result?
Yeah.
Can something be done about that?
It can, yes. So there is a product called hyaluronidase, which breaks down filler, and you do... I do that for aesthetic purposes, not my own work, I will say. It's, people come in with migrated lips is a very common one. So
what's a migrated lip?
So migrated lip filler, it's where the lip filler goes above the vermilion border, and they get that big shelving, or the big, the lips just look, and I've seen...
They come through the door before the rest of the person?
Unfortunately, or, they've just used... they haven't, from an aesthetic point of view, they haven't done the right thing by the patient, or, migration does happen. It does happen. So, it's a treatment that I do in my clinic, and if a young girl, and I've had young girls come in and they've wanted more lip filler, and I will not put more lip filler in. I speak to them about what migration is, because they've been walking around with this migration, not knowing exactly what's going on, but once I point it out to them and I show them images, that's why I look like I have a mustache, or, they
so
don't...
they're thinking they need more to try and combat it,
Correct.
not less.
Yeah,
right.
So, I've refused treatments before, and my girls that I have treated, every single one of them has gone through with the highlasing process, which is a process. We have to highlaze the lips, they come back down again. It does highlaze, or hyaluronidase, breaks down your own natural hyaluronic acid store, so you've got to be quite mindful of the doses that you're giving, and then we need to start again. So it's a process, and it's something that they have to wrap their heads around, but
so I think the hyaluronic acid, people put that on their skin too, don't they?
Yeah, so you've got it in a serum form. Yeah. So we start losing our hyaluronic acid from about 25 years old. So it's what gives us, our skin looks crepey, and when we're younger, those hyaluronic acid stores are, beautiful and full, so we're all plump. Yeah. And as we age, that's what starts to go. So that's basically, with the filler, what we're doing is we're... we lose, as we age, we recess in our bone, we recess in our fat pads, and our ligaments start to get more lax, and then our skin has nowhere to go but down. So that's the process that I explain to the clients, and how they, understand that basically all filler is we're putting back in what you once had.
The volume.
We're not here to change your appearance. Yes, sometimes we, a female chin will be too wide for her. She'll have more of a male chin, so we want to feminize her. So there's all different, treatment plans. If, for an older lady, we're looking to replace volume and look refreshed. For a young female who comes in and she's lacking, shape in her face, or she's got, a wider jawline than cheeks, it's about feminizing the look. And again, they'll come in like, I'm not really sure what's happening with my face, but what can I do? And so there's feminization. We can make men look more masculine. We can widen their jaw. They might have a feminine jawline. So it's all about the process and figuring out what
there is. I'm really curious about, and I'm sure I'm not the only person to have thought this, what happens if you've gone through all these procedures and then you get to you're 65 or 70, I'm done, does your face just suddenly just melt?
It does. It does over time. Yes, the filler will eventually dissolve, like naturally dissolve itself and break down. So depending on the area that we treat and the type of filler that we use, you'll have longevity ranges from anywhere between 12 months to 24 months, depending on the type of filler that you have.
What about your lips? Would they have been stretched to the point?
No, they'll just go back to normal. But as we age, a lot of the time, our lips do, because our bones recessing back in, our lips come in with it. So we get that thinned lip, or our orbicularis oris muscle, which sits around our mouth like a calamari ring. We've been talking for 40 years, 50 years. It's like a muscle, like any part of our muscle in our body. It's going to strengthen. So it'll tighten up. And you'll
be very strong.
So you'll get thinned lips. So it's not about you'll have this more sagginess. It'll just dissolve naturally.
Okay.
So yes,
you don't
there are.
That's what I've always thought.
There are. I mean, if for whatever reason something happens and you don't like the treatment, yes, there is.
It's reversed.
Yeah, and I guess, as a sonographer, I've got ultrasound in my practice, so currently when we're highlasing things for aesthetic purposes, we're kind of just going in and highlasing the area, but with ultrasound I can pinpoint exactly where that filler is.
That's amazing.
And go in. So I can be more targeted in my approach. I'm not breaking down someone's natural stools. And the same thing with the risks of filler. There are risks of a vascular occlusion. It's where a little bit of the filler can get into an artery and block it off. Again, we have highlights to break that down, but with ultrasound I can be very targeted, know exactly where the blockage is, and highlight it and restore the flow again. So
I think it just really brings us to the point that you really need to see somebody who knows what they're doing.
Absolutely.
And has got, like medical qualifications, and clearly you do, Amanda. You're amazing. And we just wanted to say thank you so much for joining us today.
No problem. I hope that
really learnt a lot. Learnt so much. And I'm not frightened of procedures anymore after talking to you. I mean, I don't know if I'm ready for that next step, or if I ever would do that next step, but what you've done for me so far is incredible. Taking that headache away was just like amazing as far as I'm concerned. You're my best friend.
Yay.
And I know Gerlinda will probably be in next week.
Yeah, exactly. No, I know. That's right. Alison's such an amazing referral person. For people that, obviously you're based in Cairns, so for people, we do have people that listen around Australia and the world. What would you recommend if somebody is looking for somebody that does want somebody with your sort of medical background? What would they be looking for in terms of a cosmetic practitioner?
You really want to look at, obviously they're registered nurse, or registered doctor, because doctors do cosmetic procedures, so they have an APRA registration, and then it's always a great idea to look at their socials, so Instagram, Facebook, because good injectors will have a lot of before and afters. So they should be showing their work, seeing a before, seeing an after. And then once you've had you've gone through and had a look, then you can always contact them. And I always recommend a consultation when you're nervous. It's always a good idea to sit down with your injector, have a chat about what your aesthetic goals are. Make sure you're comfortable with them. If you're comfortable with them and you've developed a good rapport, then moving forward is going to be much easier than feeling. You should walk out of there feeling comfortable about the decision that you're about to make, not feeling apprehensive or worse about yourself. You should be walking out of there excited that you've got this amazing plan that you're going to move forward with, and so that's what I would recommend.
Wonderful. Thank you so much.
No problem.
It's been absolutely fascinating. Like you said, there was just so much more. We could just keep going.
Yes, loved it.
Thank you so much for watching The Divine Style and listening. If you're listening to our podcast, be sure to like, share and subscribe, and we'd love to hear your feedback if there is any other topics you'd love us to discuss. Thanks for listening to The Divine Style with Gerlinda, Stella and Alison Maiden. You can ask questions or find out more at gerlinda.com.au or alisonmaiden.com.